Hi, good afternoon. My name is Terika Thomas Mills, and today I'm going to demonstrate IV and medication administration. I'm going to start by performing my hand hygiene, and I'm going to apply my gloves. Okay, so I have gathered my supplies. I have my primary fluid. I have verified the physician's order in the MAR. I have verified the 6 rights of med administration. I've verified that I have the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. For our fluid, I have my macro drip set, which is 15 drops per minute. I also have my piggyback. The physician has ordered 250 milligrams and of amoxicillin, and this is to run at 20 drops per milliliter, and it is supplied in 100 ml. So this is my piggyback, and it is supplied in 100 ml. And I have also verified the 6 right of medication administration for this medication. I have verified that I have the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. I have also verbally confirmed with the patient that he has no known allergy to this medication, and I've also checked in his chart to confirm that he has no allergic reaction to amoxicillin. And for this, my macro drop set is 20 drops. It is supposed to be 20 drops per ml. I have my alcohol pads, and I have my piggyback hanger here. So before I start, I have to do my calculation for my medication. For my fluid, the physician has ordered 150 ml, and it is to run for 60 minutes at the rate of and it's supposed to be 15 drops per ml, and based on this calculation, it is going to be 38 drops per minute. For the secondary, the amoxicillin, this was ordered in 20 milligram. It was ordered in 250 milligram, I'm sorry. And but it is supplied in 100 ml, and this is to run for 15 minutes, and it's supposed to be infused at a rate of 20 drops per ml. And the calculation shows that this is going to be the infusion rate is going to be 133 drops per minute. Okay, so now that I have done my my calculation, I am gonna spike my bag and prime my line. So for my primary, I have my tube. For this tube, here I have the spike, which is to be left covered. Since this is the part that goes inside the medication, we want to ensure that it remains sterile. Next, I have the drip chamber, and this is what prevents the air from entering the tubing, and it also helps us to visualize or flow rate. Next, I have my roller clamp, and this is what regulates the flow of the medication, and we always need to ensure that before we start it is in an off position. That way the all the medication doesn't just run straight through the tube, so we ensure that the roller clamp is locked. Next, we have the Y-site, and this is for medication administration via IV bolus or IV piggyback or secondary infusion. And finally, we have and when we're gonna use the Y-site, we have to make sure that the medications that we're gonna be administering, the medications are compatible with each other. And here I have my adapter end, and this is the end that goes in, that is attached to the patient's IV site. Okay, so next I am gonna remove the cap from my fluid. I am gonna remove the spike, the cover from my spike, and I'm gonna insert it in the bag. I'm gonna spike the bag, ensure that it goes all the way in. And like I said, I have to ensure that the roller clamp is in a locked position. Next, I am gonna hang this on my hanger, and because I am also gonna be hanging a piggyback, I have to ensure that this is hung lower, and I have to make sure that it's hung at least 30 inches above the patient's IV site. All right, so now that I have hung this up, I am going to prime my line. I'm gonna squeeze my drip chamber until it's half full. Okay, and now that it's half full, I am gonna open my roller clamp so I could prime my line. I'm gonna allow the fluid to drain. I'm gonna allow the fluid to run all the way through my line, and it's dropping in my garbage can. Okay, so after I have allowed the fluid to run, I need to make sure that it runs all the way through, so there is no air bubble in the line. Then I'm gonna go ahead and I'm gonna turn off my roller clamp. Next, I need to confirm my drop rate. I am supposed to have 38 drops. I'm supposed to have 38 drops per minute. So I am gonna go ahead and I am gonna count for 1 full minute to ensure that my infusion rate is correct. Okay, so I'm gonna go ahead, I'm gonna open my roller clamp. I'm gonna slowly open it. Okay, and then I am gonna go ahead and I'm gonna count for 1 full minute. Okay, so I have counted for 1 full minute, and it was, in fact, I've counted for 1 full minute to ensure that my drop rate is accurate, and it was actually 38 drops for that 1 full minute. So in the real world, I would allow this infusion to continue running, but because I don't want to because I don't want to waste the medication due to limited supplies, so I'm going to turn this off. And normally we would use the alcohol wipes, and normally I would clean the IV site of the patient, and then I would allow it to dry, and then I would attach my adapter end, and the infusion would continue. But due to I don't want to waste my supply, so I'm going to turn this off. All right, so next I am gonna I'm gonna spike and prime my piggyback. Again, this is supplied in 100 ml, and this I am gonna I have a macro drip, which is a macro drip set is 20 ml, and this is gonna be running for it's 20 ml, and this is supposed to be running for 15 minutes at 20 drops per milliliter. So I'm gonna remove this, and the parts are the same. I have my spike end, my chamber, my drip chamber, I have my roller clamp, and I have the adapter end. The only thing is that this doesn't have a Y port. So I am gonna go ahead, I'm gonna open this, I'm gonna spike my bag. And again, when you're spiking the bag, you want to make sure that the roller clamp is in an off position, so as not to allow the fluid to run all the way through. So I'm gonna hang this, and this I'm gonna hang, because it's medication, I'm gonna hang it above my fluid. All right, so again, I have to go ahead and I have to prime my line. And in order to prime the line, I'm gonna squeeze my drip chamber until it's half full. Okay, so I'm gonna open my roller clamp, and I'm gonna allow this to run all the way through in my trash can. Okay, so now that I have removed all the bubbles, I am gonna go ahead and I'm gonna close my roller clamp. I am gonna double check my my drip rate. I'm supposed to have 133 drops per minute. So now I am gonna go ahead and I'm gonna count for 1 full minute to ensure that my infusion rate is accurate. I'm gonna count for 1 full minute to ensure I have 133 drops. So I'm gonna open my roller clamp again, and I'm gonna allow this to drip in my garbage can. I'm gonna slowly open my roller clamp. Okay, and I'm gonna count for 1 full minute. Okay, so I have counted for 1 full minute and I got 133 drops for the minute, for the full minute. So now I am gonna go ahead and I am gonna take my, I have turned my, I have closed my line, and I am gonna go ahead and I'm gonna take my alcohol wipe. I am gonna clean my Y site. I'm gonna allow it to dry. And once it's dry, I'm gonna go ahead and I'm gonna attach my amoxicillin medication. I'm gonna attach it to my my primary line. Okay, so once this attached, normally this would be attached to the patient. So now that the medication has been applied for the patient, I'm gonna go ahead and then I'm gonna reassess my patient. I have to reassess my patient. I have to double check the IV site. I have to make sure there's no redness and there's no swelling, or the patient is not having any pain at the IV site. And since amoxicillin is a high allergy, it's a high risk allergy medication, I want to ensure that the patient is not experiencing any hypersensitive reaction. And if the patient is experiencing any reaction, then I would pause the infusion. So the patient seemed to be tolerating the medication well. So normally I would stick around to see if the patient is experiencing any allergic reaction, but because the patient is not, I am gonna go ahead and I'm gonna put my patient in a position of comfort. I am gonna ensure that the call bell is within reach. I am gonna gather my supplies. Oh, and I'm gonna gather my supplies, and before I leave, I always I have to make sure that both bags are hanging, both the fluid and the medication. I have to ensure that both of them are hanging at least 30 inches above the patient's IV site. So now that everything is okay, I'm gonna go ahead. I have gathered my supplies. I'm gonna remove my gloves. I am gonna perform my hand hygiene, and I'll go document my procedure.